we're able to do a form of reconstruction utilizing most commonly the tummy tissue in a woman, or at times the inner thigh tissue, and the tissue is isolated on very tiny little blood vessels. The tissue is then transferred up to the chest wall, and the blood vessels are hooked up under the microscope, allowing that tissue to live. What we've been able to offer women at the University of Kansas is the ability to do that procedure with very minimal injury to the stomach muscles, so that even in a young woman, once they've recovered, they're going to be able to do all their normal activities. They're not going to have any significant abdominal wall weakness, and that can really impact their quality of life very dramatically.
These are the basic types that we have right now. There's two compositions of implants. There's the saline implants here. It has an air bubble. It wouldn't normally have it, but this is what it looks like. You can see some of the problems with this is that it's a little more firm and there's some rippling associated with it.
Okay. Yeah, I saw that.
Some women like this though, just because if something happens to the outer shell and it gets a hole, it's just salt water, so your body will absorb it. Then you have here, these are two types of implants. These are silicone implants. This is a sort of a semi-solid cohesive gel implant. Okay. It's a little softer. A lot of women like that for reconstruction, yeah, because it has a more natural feel to it. And then here's a more solid implant that if you cut it in half, it looks like a gummy bear, and it maintains its shape.
I've seen people talk about the gummies online, yeah. Say gummies.
So the one nice thing about these is it gives you a more rounded shape and a little bit more projection. This will give you more of a slope, and this will also give you somewhat of a rounded shape. So it's really, they're all safe options. It just depends on what you prefer and what you like. Had the silicone implants, the ultra high profiles put in. Mm-hmm. You're okay with the volume?
Yeah. And I think I have told you they were up really high, so I was wearing the band to push them down. And so now really just the contouring, maybe I could work on that. But I really like the feel of it versus the expanders. Definitely, it was a huge difference.
Oh yeah,
definitely a big difference. Yeah, it feels more natural and not so uncomfortable. So.
You have to wait for everything to settle for about 3 months.
Okay. So that would put me in the summer. So since I'm in the water a lot, is there any way I could delay it till after boat season?
Yeah, okay. You could do it as long as it's after 3 months. You could do it whenever it's convenient for you.
So.
Push your scales on.